Pope Francis is now fully vaccinated against COVID-19. The message to Catholics is clear: get vaccinated. And it's not just the Pope. Orthodox Rabbi Shmuel Herzfeld became a TikTok star after sharing his vaccination videos. Reverend Albert Mohler, president of the Southern Baptist Theological Seminary, says he's going to get it too. Religious leaders are quickly becoming leaders in the push to get vaccinated.
As a scientist, I cannot stop thanking God for all the vaccines. I was vaccinated on Friday. The grave necessity for ending the pandemic is such that for the sake of the common good, we have to embrace those vaccines as a way of loving our neighbor.
At this point, COVID vaccines have been deemed safe and effective. What's noteworthy about religious leaders getting vaccinated is more a question of ethics. In short, if you're anti-abortion, how do you square taking the vaccine, knowing that fetal cell lines can be used in their development or testing?
The interesting thing is that there's been, to my knowledge, very little open resistance to the use of these vaccines.
Fetal cell lines are exactly what they sound like. Cells taken from the tissue of a fetus, some from abortions. The connection to COVID vaccines, though, depends on which vaccine you're talking about. Pfizer and Moderna's vaccines didn't use any fetal cells in their development, thanks to their mRNA technology, but they did use them to test that the vaccines would produce the right antibodies.
In order to make an mRNA vaccine, you can do all of your synthesis in a test tube. You at some point want to check to make sure that the mRNA produces the right protein. And the easiest way to do that is to put a little dose of it into some cells, in this case HEC293 cells, and make sure that they produce the correct protein.
It's important to note the cells used here aren't brand new cells. They've been around for decades. The one used for some COVID vaccines is called HEC293. It stands for Human Embryonic Kidney, and it was obtained back in the 1970s. Now, HEC293 is immortal, meaning that it reproduces on its own indefinitely. For anti-abortion Americans considering getting the vaccine, that distinction could be pretty important.
Now, the fact that using these vaccines will not lead to future abortions simply because the HEC293 cell line is an established cell line that has been around for decades is actually morally important. It's important to know.
Well, then why would anybody object? Well, imagine if you were a college student and you found out that your college was founded by someone who made lots and lots of money in the slave trade. You might have some problems with, geez, why don't we name it after him? Nevertheless, you know, there are no ongoing abortions that are being used to produce these vaccines.
The use of fetal cell lines in vaccine development is actually pretty common. The scientific advancement has led to breakthroughs that have saved countless lives. Chickenpox, rubella, hepatitis A, rabies, the vaccines for all of these diseases used fetal cell lines. When it comes to COVID vaccines, the Oxford, AstraZeneca, and Johnson & Johnson shots took a more traditional approach. The Oxford AstraZeneca vaccine used HEC293 to develop its COVID vaccine, while Johnson & Johnson used a different cell line to create its single-dose COVID shot, also derived decades ago.
For all but Johnson & Johnson, they were using the HEC293 cell line, which was derived in 1973 and has just been grown in labs ever since then. The one that Johnson & Johnson uses has been derived in 1985 and grown in labs ever since then.
The United States Conference of Catholic Bishops says the reasons to accept the new COVID-19 vaccines from Pfizer and Moderna are sufficiently serious to justify their use, despite their remote connection to morally compromised cell lines. But that same group of Catholic bishops calls the Oxford AstraZeneca vaccine more morally compromised. The Charlotte Lozier Institute, an anti-abortion group, agrees in its analysis of the major vaccine candidates and encouraged pharmaceutical companies to pursue other avenues of research going forward. But the Vatican didn't make any distinctions between vaccines in its guidance, even suggesting it would be wrong to refuse a COVID vaccine over abortion objections.
It was important that the Vatican affirm what Catholic moral theologians had argued, that it was a historical event and that using these vaccines is unlikely to lead to future abortions that many would find morally problematic.
There really aren't any alternatives that were not made using fetal cell lines. This will help far more people right now, and so we should go for it.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.